Today I'm going to talk about ways to turn scholarship into publication. Everyone's always talking about writing more and how important writing is. And what we're going to talk about today is some strategies of how to increase your writing productivity. So academic scholarship is an area that we all participate in as faculty. Academic scholarship is required for promotion. It's a great way to disseminate your expertise. It helps you establish your reputation, which we all know is very important when you're going up for promotion. Publications are more widely distributed than presentations. And an example of this is, say you see an interesting patient in the hospital and you present the case. There are maybe 20 people at Morning Report and they hear about this interesting case and they think, wow, that's a really interesting case. And that's where it ends. If you were to write a case report about that, say you have a patient with an unusual presentation of Sheehan syndrome or some other endocrine syndrome. So you've done the case presentation and you've presented to the 20 people. Maybe they've told a couple of their friends, and so maybe 30 people have heard about this case. If you write a case report about it and it gets published in a peer-reviewed journal, then not only have you presented to those 30 people, you have it written down where, you know, maybe a few hundred more people will read it. And then anyone at any time who's doing a literature search on that condition will pull up your case report. So you really have the potential to make much more of an impact than just giving the talk. Another reason for scholarship is that we follow our passion, and the RSC requires that all residency faculty pursue some type of scholarship, and that includes publications. When we ask audiences of faculty, most will tell me that they give talks. Pretty much everybody, if you're a faculty, is going to give talks, but not as many will write. And here are some of the reasons why. So a talk you can do in outline form. People say that you have less formal documentation. You do not need to cite everything that you say. It probably takes less time than writing, and you can do in smaller increments of time. So for instance, you can make up a few slides here and a few slides there. When you are writing something, there is pressure to be polished. I mean, it's a one-time written piece of material that people are going to read, and you want it to look good. A lot of people are intimidated by the idea of writing. It does probably take some more work, but we're going to talk about that, about how you can use the same legwork that you use to put together your talk and transform it into the basis for something that's written. A lot of people tell me that they need large blocks of time to write, and so that's a main barrier, is they just don't have 3 hours to sit down and write. And there's really no room to wing it as you can do when you're giving a talk. When you're giving a talk, you can also incorporate personal experience, personal stories, which is certainly not part of what a written product would include in most situations. So barriers to writing, and this is borne out by a lot of different studies. The number one is people will say time. They're just, in a faculty day, week, month, there's just not a lot of extra time, and people don't have time to sit down and write. Knowledge, people don't really know how to write. They don't know how to start. They don't have good mentoring. They're overwhelmed by this idea of having a huge amount of work to do and not even knowing where to start. They're not comfortable with the writing process. They feel a lack of support. Obviously, competing demands, clinical demands, tend to take precedence, which is appropriate. And then the last part is initial failure. So for people who've written something, submitted it, gotten it rejected, I've talked to a lot of faculty who say, I never revised it and resubmitted it, and that was the last time I tried to write something. And that was however many years ago. So they get discouraged and then don't go back to it. So there are lots of different approaches to writing, and everybody is different in this. And this is sort of one of the first things that I tell faculty when you're about to start on a writing project. Really think about what works for you. Go back to the last time you actually did write something and think about what helped you be successful. Some people like to do detailed outlines. Some people like to do stream of consciousness and just start writing. Some people will spend a lot of time thinking about how they're going to structure a piece before they actually put something down on paper. This idea of writing and then rewriting. Just get something down on paper, and a lot of times the revision process will help make the paper better. And then there are this conflict between big chunks of time versus small increments. A lot of times people don't have or they can't find 2 or 3 hour chunks, but they could find an hour here and an hour there. And if they do that on a regular basis, they actually can get a lot accomplished if they break down the writing into smaller pieces. So finding time to write, barring all of us needing less sleep or adding extra hours to the day, there is a limited amount of time available. So knowing yourself, how you write, when you write the best, and knowing what can make you successful is really important. We want you to compartmentalize. So if you have an hour to write, it's not a good idea to open up your email at the same time, or don't open up Epic and start answering notes. Maybe turn your pager off. Tell your nurses, I'm unavailable except in an emergency for an hour. Close your door. Go somewhere that doesn't have internet access where you can only type. Some strategies people use to avoid distractions and really focus. The other reason that a lot of people don't write is that the deadlines are mostly self-imposed. So it's not like you actually have to go in and see a patient or you have to finish a chart note. You have a paper that you're writing and there's really no due date unless you set one for yourself. So setting your own deadlines and keeping them can be really helpful in increasing your productivity. What some people like to do is either join a writing group or write with a partner, and that way you can keep each other accountable and set deadlines for the other person. There are also ways of multitasking a little bit. If you are stuck on call at the hospital, that's a perfect time to start a literature search. That's a perfect time to start writing an outline. If you have a half hour, you're waiting to pick your son up from his guitar lesson. You have a half hour, write an introduction. Think about how you're going to structure your paper. There are lots of different types of publications, and everybody will find one that they enjoy and that they're good at. You can write personal essays or narratives about your clinical work, about your teaching, about your personal life, about work-life balance. There are lots of different ways to incorporate what we do every day into a written piece. Review articles, systematic reviews, research articles, evidence-based medicine reviews, which tend to be shorter, more focused, and answer a specific question. And that can be really helpful if you don't have a lot of time to do, say, a review article. You might want to do an evidence-based medicine article, and that would be a great first foray into the writing community. A case report or a series, again, that interesting case that you're presenting at Morning Report, look in the literature and see if there's a lot written about it. There probably isn't if it's a really interesting, unusual case, and that would be a perfect thing to write up. Blogs are a really fun way to sort of get into writing. They are short, they don't necessarily have a lot of citations, and can give you some experience starting to actually put something down, not really on paper, but put something into writing that then may be able to be used in a larger sense for other publications. So I'm going to talk about, for the next few minutes, about one way to take the work that you've done giving a talk. We're going to go back to this case presentation again, where you've done some research, you've described the case, and we're going to talk a little bit about how you can take that and make it into something that is written. PowerPoint has a lot of different ways that help you develop your talk into a written product. The notes page in a PowerPoint presentation gives you a way to type out what you're going to say about the slide, and you can actually just copy and paste that, and that can become part of a rough draft. The lecture itself serves as a built-in outline for the paper that you're going to write. What some people would like to do is they like to tape them giving the talk, have somebody transcribe it, and there you have a rough draft that will need some editing, obviously, and some citations and formalization, but can actually give you a great first product to have down on paper. The idea of transforming your lecture into a publication emphasizes that if you put extra time in at the beginning and are organized, you will be able to come out of it with a great start toward a publication on this same topic. So if you put in time at the beginning, you're organized, you know yourself and your work style, update the notes pages, and usually when I cite articles and when I look stuff up to give a talk, I will put the citation in the notes pages so that I have everything in the same place. So the checklist that I go through, obviously the first thing you're going to think about is this topic, say our case presentation, appropriate for an article? We're going to look in the literature and see if there are, 23 case reports of a similar type, then maybe this is not the right case to write up as a case report. But if there aren't, then there's certainly a gap in the literature, and it's an important topic. Is it a new approach to something? Are you combining different literatures? Is there new research available? Are you looking at a condition in a different population? Do you have an innovative teaching idea or an innovative clinical idea? Any of these things, then there is probably an audience for a written product. If you're going to write something, you want to have a journal in the back of your mind, not only so that you have something to look toward, but also so that you, when you're writing, will actually put it in a structure the paper in a way that fits with the journal's guidelines. Where would this topic be appropriate? Who are you writing for? Who's your target audience? It's usually a good idea to have first, second, and third choices of journals. Again, I don't want people to get disappointed and not try again after they get rejected the first time, because a lot of times, the majority of times, you're not going to get accepted to the first journal you submit it to. So if you already have journal 2 and 3 lined up, then that's not as big of a blow to your ego. If there are articles that are similar in structure to what you want to write, but on different topics, review those, and they will certainly help you in putting your paper together. And then review the instructions for authors for that particular journal. If the journal says write a 100-word abstract and you send in a 200-word abstract, obviously the journal is not going to be as happy with that paper. So the third thing on the checklist is to set aside some time to develop your ideas. How do you put together lectures? When do you find time to do lectures? We're using the literature review that you're using for your lecture as the basis for what you're going to use for your paper as well. You're going to come up with goals and objectives of your lecture, which are also going to be goals and objectives of your article. They will help you in organizing your paper and developing an outline. And you're really going to think about and look at your schedule to find increments of time that are appropriate to what you want to do. So if you have 15 minutes and maybe you can read one of the review articles, or maybe you can read a similar case report that will help you structure yours. Then you're going to think about what method you're going to use. Do you want somebody to audio tape you and transcribe it? That might be helpful. Are you going to use the notes pages? You're going to just use a detailed outline from your talk and then fill in based on what you're talking about. Every time you look over your notes and you look over your presentation, add to the notes page. The richer that notes page feature is on PowerPoint, the more substance you're going to have just to start out with your paper. And then you're going to do a continual reassessment. If you start in this endeavor and realize there's really not much here and I don't think this would be a good paper, well, cut your losses. Don't continue, obviously. Think about changing the format. Reevaluate after giving the talk that you gave. I mean, if people weren't very interested in your talk, then maybe people won't be very interested in your paper. Maybe if people have serious questions that you didn't answer, you go back and sort of reformulate how you're going to put everything together. And it's a great idea to use questions and comments by the audience to help you revise your paper. And that's your first sort of editorial process, is that the audience is helping you in developing a better product. And then number 6 would be submitting your paper. And don't get discouraged. Revise and resubmit. If the journal rejects the paper, go to the next journal. Think about asking a colleague to read your paper. Are you missing something? Are you getting your message across? Does it make sense? Is it well written, or is it confusing? Certainly asking the person who's sitting next to you, who's also a faculty member who has probably written a lot, can be a little less scary than sending to a journal where you might get feedback from people who you don't know. So in this way, you can actually take the information that you use to develop your talk and make